requires citizens to voluntarily avail of these programs. So, for example, governments can establish vaccination programs to reduce the spread of infectious diseases, but that is not really going to achieve its desired goal unless citizens actually choose to get vaccinated. Governments can build schools and hire teachers, but unless families send their children to school, that is not actually going to result in an improvement in educational outcomes. So we were motivated in this project to understand under what conditions can government actors themselves motivate citizens to participate in these government programs. The second motivation is with regard to politicians. And politicians across the world, we see this in India, we see this in Bihar, we see this all over the world, in the US as well. They also play an important role endorsing and spreading awareness about government programs. But we don't really know about what the effect of these encouragements are, right? So this was the motivation of this project, is that can locally embedded politicians and their endorsements and their encouragements be used to encourage citizen participation in government programs and to encourage them to avail of, enroll in government programs. And so we have two components of this project. I'm going to just present one today. The other component, which I will not present, has to do with changing attitudes amongst families with respect to investing in their children's education. So I'm happy to talk about that project. If any of you are interested, just come find me later on in the conference. But today I will be talking about health insurance. Can I have the next slide, please? So I will skip over the slide, except to say that this project aims to contribute to a few different strands of the academic literature in political science, in economics and public policy, ranging from literature focusing on citizen-state interaction and the factors that help make citizens more willing, for example, to pay taxes. The literature focusing on the politics of public service provision, and this is an area where I have done a lot of research, and the literature on leader authority and influence. So, in a policy school, I think we think a lot about leadership, and we want to know where the influence, how and where the influence of leaders come from, and that's what this project is trying to speak to. Can I get the next slide, please? So we start out with this question of how and why politicians' endorsements might shape citizens' willingness to avail of government programs. And this is sort of a question that originates in the literature in the US, where there's a lot of work done on the role of elite cues. So for example, citizens might be not informed about a lot of policies or a lot of policy issues, and so they often rely on elites, whether it's politicians, whether it's government officials, it might be celebrities, to form their own opinions about certain issues. So we were really starting from that place in the literature, but of course we're applying this to India, and we're applying this to the question of government welfare programs, and we're asking, how do politicians specifically differ from other elites? And we start out with this kind of assumption, or this sort of, a long-standing kind of, research program that suggests that politicians might be different from other elites because they compete in elections, and because of this, they need to appeal to some groups of citizens over others. And this might actually shape how the impact of their endorsements when it comes to citizens' willingness to take up government. So we focus on three factors. First, we focus on partisanship, and this again is informed by a large literature in the United States that suggests that people really trust elites from their own party, and we want to see if that applies in India as well. The second strand of literature that we kind of draw on is with regard to decentralization and local governance. This is again an area that Professor Samantha and I are building on in our own research. And this research suggests that politicians really have close ties with their own constituencies, and so they have the biggest impact amongst their own constituents. And then finally, the importance of ethnicity, which again has been talked about in the context of the US, talked about in the context of India, and here we're examining that empirically to look at the effects of that. Can I move slide? And the next sort of, kind of theoretical building block that I want to introduce you before I move to the data is sort of why politicians might have an effect. And briefly, I'll say that there's two possibilities. One, which is inspired by the literature in the US, says that politicians, because they're policymakers, might have more information about government programs, and that's why people listen to their opinions when they decide whether or not to avail of these programs. But there's another view, which is that politicians have a personalistic influence in implementing programs, and citizens might listen to their opinions, their endorsements, and view that as a signal of their personalistic involvement. So we are trying to test these two mechanisms in our research. Can I have the next slide, please? So the specific program we focus on might be familiar to many of you. It's the ABPMJ scheme, which, as many of you might know, is a nationwide health insurance scheme that is implemented all over India, including Bihar, and that entitles beneficiaries, it's free of charge to enroll, and it entitles beneficiaries to 5 lakhs rupees of annual coverage for secondary or tertiary care, and the eligibility has recently been expanded to all ration card holders and then everyone over the age of 7. So that is going to be our focus when we're trying to understand what helps citizens avail of government programs. Can I have the next slide, please? And we're going to focus on 2 levels of politicians. We're going to focus on a state minister, and we're going to focus on mukhiyas. And I don't need to tell you, given this audience, more about that context here. I think everyone understands this context. Next slide, please. So we conduct a very large-scale survey in partnership with the Policy and Development Advisory Group, PDAG, who are based in New Delhi and who have large enumerator teams working in many different states, including Bihar. And so our sample is drawn from 2 districts in Bihar, Madhubani and Jamui. And we sample from these districts 8 administrative blocks and 5 gram panchayats. So we end up with a total of around 4,300 respondents from across these areas. So it's a pretty large-scale survey. And I can say a little bit more about the sampling strategy if anyone is interested, but I'm not going to get too technical here. And just keep it high level at this point to say that we sample from 50 different gram panchayats, and we construct gram panchayat pairs because we want to increase the control we have in our experiment. Next slide, please. So our experimental treatment, this was something we were quite excited by. We want to rely on sort of local leaders and their own messages about this ABPMJ program to see how their messages have an impact on citizens' willingness to avail of this program. So in several rounds of initial field work, we conduct several focus groups and interviews, but we also interview politicians, especially mukhiyas, and try to encourage them to record video messages that encourage people in their district to enroll in the ABPMJ. And we measured 3 outcomes. The first is whether people want to know more about the ABPMJ. The second is we actually, through our enumerator teams, provide assistance to people to enroll in the program, and we see to what degree they are interested in taking up this assistance, to what degree are they interested in taking up our enumerators' assistance to enroll in the program. And then finally, through a vignette, we measure how efficacious people think the program is going to be, right? So it's very simple. The idea is that we administer these video messages, and we do it in an experimental design, so we can actually measure the impact of these messages, and then we look at the impact of these messages on these 3 outcomes. Next slide, please. We also measure through what mechanism these messages might have an impact. So we have several measures of kind of trust and perceived knowledge and perceived expertise. Next slide, please. So here is a little snapshot of the experimental design. So we have sort of two cross-randomized treatment arms. And so in the first one, we vary what type of state actor is featured in the video that you will see. So it's either a state minister, and we actually get the Bihar State Health Minister a YouTube video, and we take from that YouTube video and make an edited clip. And then we have the videos that we get from the Mukhias. And so they either get a video from the Mukhia, or they get a video from the state minister, or they get a control video. Now the important thing here is obviously the videos, the messages that each politician sends is going to be different in terms of content. And we want to understand to what degree are people being influenced because of the official position of the politician. So we also have another treatment arm where we edit the video so that one version of the video conveys the position of the politician that the people are seeing, and the other version of the video just has everything the same, but doesn't include the information about the position. And that gives us a degree of experimental control where we can isolate the effect of the politician's actual official position on people's willingness to take up the program. Next slide, please. So these are some examples of the videos we obtained from Mukhias. Next slide, please. And this is the sort of YouTube video that we compiled from our very honorable state minister, in Bihar. Next slide, please. And then we have several other moderating variables that we capture to try to test some of our key hypotheses. Next slide. Go to the next slide. Next slide. Yes. So we have three main hypotheses that we want to test, which is that politicians' influence is going to be stronger among citizens who belong to their support base. So in the case of the state minister, we expect the influence to be stronger amongst co-partisans. For Mukhias, we expect the influence to be stronger amongst their own local constituents. And for both, we expect that the influence should be stronger amongst co-editors. Next slide, please. But we also want to test how politicians' influence works. And so I won't go through these observable implications in great detail, but what we're trying to really capture is whether the main reason that people listen to politicians' endorsements is because they trust their opinions regarding, the information they provide about the program, or because they see the endorsement as a signal of the politician's personalistic involvement in the program. And those are the two mechanisms that we're trying to test. Next slide, please. So here is some information about our sample. This is just a picture of one of the focus groups we did in Gaya, so it's a little unrelated. But as you see from our sample, we have a good representation of marginalized groups. We have a good representation of fairly low income population. The vast majority are unmarried. Levels of education are low, and it's moderately gender balanced, a little less than 50% female in our sample. Next slide, please. Now this is an interesting slide, perhaps even regardless of the project. So the people we sample, the respondents we sample, are people who are eligible for the ABPMG, but who have not yet enrolled. And one might expect that this is, we might want to know why these people have not yet enrolled. And one might think, well, maybe they just don't have very high health expenses, or they don't really, go to the hospital much. Secondary, tertiary care is not a priority. And we see that that's actually not the case in our sample. So about 40% of the sample has incurred some kind of hospitalization expense in their household in the last year. The amount they spent on a doctor's visit in the last year is quite a high percentage percentage of the household income. The vast majority perceive their current health expenditure to be high, and also perceive their future health expenditure to be even higher. And so we would expect that this is a population that could really benefit from enrolling in the ADPMJ, and I'll come back to that later. Next slide, please. So again, we might question, well, why haven't people enrolled in the scheme? Do they just think that the scheme is not going to be beneficial, or is there some other constraint? And what we find is that in our overall sample, only 1% say that they haven't enrolled because they don't think the scheme is beneficial. The most popular reasons for people having not yet enrolled in the scheme are that they haven't heard of the scheme, they didn't have time, or they were away from home. So again, this suggests that a project like ours that seeks to sort of spread awareness about this program and to encourage take-up of this program could, at least in principle, be very beneficial in this manner. Next slide, please. So I'll skip over some of the technicalities. Next slide, please. Next slide, please. Sorry. Right. So getting to the results. So the first hypothesis we had is that state politicians, their influence is going to depend on co-partisanship. So the degree to which they impact citizens' willingness to take up this government program, which we measure according to these three outcomes, is going to depend on whether people belong to their party or not. And what we see is that when it comes to one of the outcomes, which is perceived efficacy, which is basically how effective do people think that the program will be in letting someone who is sick and goes to the hospital get free treatment as a result of the scheme, we see that this really depends on co-partisanship. So people who see the minister's message and who are co-partisans of the minister are much more likely to believe that the scheme is going to be efficacious than people who are not co-partisans. So our first hypothesis, which is really kind of derived from the US context, seems to hold water in India as well. Next slide, please. So the second hypothesis we have is that for local politicians, or in this case, mukhiyas, their impact on citizens' willingness to take up government programs is going to be the highest amongst people in their own GP. Right? So you might hear a message from a mukhya, but unless you're the mukhya's own constituent, it's not going to be very impactful. And that's exactly what we find here with respect to the outcome of whether people express interest in enrolling in the program. Next slide, please. And then finally, is it about ethnicity? So if you belong to the same caste as the mukhya, are you more likely to believe that, are you more likely when you see the mukhya's message to believe that this program will be beneficial to you? And again, we find support for that hypothesis. Next slide, please. Now, one question might be so far is, is this because of what the politicians are saying, or does that have something to do with their official position? So with our experimental design, we're able to isolate the effect of really priming the politician's official position, and we see that priming the official position of the mukhya does increase the impact of the mukhya's message on whether citizens want to know more about the program, want to know more about how they can enroll in the program. Next slide, please. And similarly, we see that priming the state minister's position, so it's not just about what the state minister is saying, but it's about the fact that this is a state minister that is increasing the likelihood that people will perceive the program to be efficacious. Please go ahead. Next slide, please. Now, the next thing that we want to examine is why politicians have an influence, right? Is it because people trust their opinions and information about the program, or is it because they see their involvement as a signal of personalistic influence? And in a nutshell, what we find is that for local politicians, the evidence suggests that the reason why people are responsive to the endorsements of local politicians is through the personalistic channel. So here's an example of a result that suggests this. So one of the things we measure in our survey is this idea of local capture, which has been a sort of long-standing kind of concept in the literature on decentralization. Some of you might know the work of Pranav, who really kind of popularized this concept and has used it to conceptualize politics in many Indian states. And so we try to get at this with a question. We ask people, do you think that your mukhya is unduly influenced by people in the village with more wealth and people in the village of their own caste? And so this is our measure of local capture, and what we find is that when there is perceived local capture, people are actually more likely to express interest in enrolling in the program. And so this to us suggests that this is the endorsements work when they signal kind of politicians' personalistic involvement in program implementation, and that is actually what entices people to get more interested in the program and want to learn how to enroll. Now, as you might remember, one of the things we do is we offer assistance to people to, at a later time, the enumerators come back and visit the household and offer assistance to people, asking them whether they would like help through the online portal to enroll in the program. And what we see is that when the mukhya is perceived to be locally captured, people are actually less likely to take up this assistance. And so this was a very unexpected finding for us, but it actually makes sense in the context of the personalistic influence, where if people think their local politician is personalistically involved in the program, they may not actually want to go through the effort of enrolling in the program through normal channels. Next slide, please. Next slide. And you can see that this, what we call this substitution effect, is more prevalent for higher caste mukhyas amongst higher caste people. And so again, that suggests to us that this might be an indication of personalistic influence of local politician discussion. Next slide, please. And the next thing we check is to what degree are, to what degree do politicians' endorsements work, because they increase people's trust in what the politician is saying about the ABPMJ, or they believe that the politician really knows and understands the benefits of the ABPMJ for people like them. We find actually very little evidence that that is the case. We don't find that politicians' endorsements work because people are more trusting of their opinions or more trusting of their ability to understand the program and how it will benefit people like them. So that, and again, sort of cuts against this idea that the influence of politicians occurs through perceived trust and expertise, and suggests that it might be more the personalistic influence that is happening more than anything. Next slide, please. You can skip that, please. Yes. So I'll conclude now, and I very much look forward to your thoughts and questions and feedback. But the kind of broad conclusion from the study, and again, it's based in Bihar, it's based in India, but it's one of the first studies globally that has looked at this question of how politicians' endorsements help. I think that's one reason why we were able to secure a grant from the National Science Foundation for this work. And what we find is that while politicians all across the world endorse government programs, we might want to question a little bit as to whether such endorsements are achieving the sort of desired goals, right? Because when politicians endorse programs, they endorse them for everyone. In principle, they want these programs to work for everyone. But in practice, their endorsements result in selective uptake. Selective uptake amongst their co-partisans, amongst their co-ethnics, and amongst their local constituents, right? So this idea of equal access to these programs is somewhat diminished when politicians' endorsements are involved. Next slide, please. And we have, many of these findings are unexpected and therefore exploratory, but we do find evidence that is consistent with this idea that is also something that is, worth keeping in mind when we think about politicians. Finally, I would say, even aside from the intellectual goals of this study, one of my interests always, especially when I do work on India, is to have a real world impact as well. And this study, I'm happy to say, did have a real world impact. About 15% of our sample, which amounts to around 530 respondents, who were previously not enrolled in the ABPMJ, actually were able to get successfully enrolled in the program through the study. So even aside from the academic conclusions that we're hoping to draw from the data, we're very happy that we were able to have this real world impact. So I will stop here. Thank you for listening and your attention and your time.
Thank you so much, ma'am. So we'll now take a break of 10 minutes and kindly be back in your seats promptly as we will continue the next part of the production. Before that, if anybody wants to have a question answer round with ma'am, so.
Yes, I'm Professor S. K. Basu, of US College. I'm also working on this local government for the last 2